From an administrative point of view, what do I need to be concerned about?
Yeah, that's a great question, Ed. It's gotten more and more complicated as time has gone on, and this really shoves it up into the stratosphere in terms of complication and potential exposure to risk. Some things that I would point out to groups are, for example, your new hire waiting period can be no longer than 90 days. You bring on a new employee, you have to start that coverage within 90 days. What a lot of groups do today is they make it the first of the month following 90 days. Well, that doesn't fly with the way the new law is written, so you're going to see a lot of employers needing to adjust that. There is something called a Summary of Benefits and Coverage, or an SBC, which people will be, soon that will be part of everybody's vernacular. Did you get your SBC? As an employer, you will have specific requirements to distribute SBCs to your employees at different times during the year, and you really want to make sure you do that, because the fine for not doing it is $1,000 per employee. Wow. So everybody, now, they are waiving that fine the first year. So up until September of 2013, you wouldn't be liable for paying that fine, but after that time, you would be. So if you don't understand your obligations as an employer today to distribute SBCs, you'll want to, again, work with a representative who can help you understand that, because that's critical. And the list, really, Ed, it goes on and on and on. We've barely even scratched the surface. I tell people the amateur hour is over. Maybe you had somebody who's worked with your health benefits in the past, who was a friend, or he was primarily a life insurance agent, but he did a little bit of health insurance. I don't think that's going to work going forward, because the requirements are just too strict. You need to find somebody who is a health insurance expert who can help you navigate what is a very complicated law.